We hope that you enjoyed this video that my chief resident has filmed in order for us to showcase our postpartum tubal ligation simulation. It is a simulation that I developed many years ago, realizing that this procedure is often performed by introductory level residents. It is also a great simulation not only for teaching them and walking through them the steps, but also for assistants to learn how to be better assist for this procedure. Please enjoy. Simulation has been a part of obstetrics and gynecology education as far back as the 1700s. There are simple and high-fidelity human simulators currently being utilized. We have enjoyed being able to give immediate feedback, teaching pearls, controlled environment, and allowing for pre-discussion and intraoperative counseling as well as debriefing. Postpartum tubal ligations are a common procedure. The knowledge and familiarity with the procedure are part of the core residency curriculum for obstetrics and gynecology. We propose a very effective simulator allowing for effective teaching of the Parkland and Pomeroy techniques, utilizing inexpensive items found in any supermarket. We will walk you through the supplies we use, including clean drapes or towels to allow for a more realistic operative field. Scissors for making the tubal portion of the simulation, as well as a skin simulator, red permanent marker, an elastic band, packing tape, regular tape, self-sealing cling wrap. I've used various types of wraps, but the self-sealing is more realistic for peritoneum than thinner cling wraps. This is one way to make the fallopian tube mesosalpinx. Take the press and seal with the more adhesive side facing upwards. Place the elastic band along the middle and fold the seal wrap onto itself. You will want the elastic band to be at the folded side of the seal wrap. You can then cut, leaving an appendage on each end, and then cut down the midline to create two tubes in one setting. Use the red marker to add blood vessels running along the mesosalpinx and into the mesosalpinx as desired. Use scissors to cut horizontally onto the elastic to create your fimbriated end. This is essentially one fallopian tube with a mesosalpinx that is ready for simulation. As you hopefully realize, this can be made rather quickly and can be stored for later use. In addition to the supplies noted, you will need to obtain your usual postpartum tubal ligation tray. This is a great opportunity to discuss each instrument. As you will see next, we use packing tape to place the end of the fallopian tube that would be the essential part attached to the uterus. You will use your regular tape on the back side of your skin to allow for the skin not to move while the physicians are trying to find the fallopian tube and walk it out to its fimbriated end. This would essentially be after you've entered the peritoneal cavity and your assistant is helping you to locate the fallopian tube. Usually we will tell our residents which fallopian tube we are working on getting so that they know which way to walk out the fallopian tube. This is where you can illustrate how to walk out a fallopian tube, either using the same instruments or in this case 2 different instruments. Here's where they've isolated the fimbriated end to confirm it's a fallopian tube, not a round ligament. Here's as if we were placing the mesosalpinx and part of the fallopian tube back in and walking it out to the mid-segmental portion. This is where you can teach your resident physicians where to find a location that is more inclined not to cause bleeding. And here's where the physician has been able to successfully penetrate the mesosalpinx to do a Parkland type technique. This is where you could use your discretion to teach them how to walk through the the suture one at a time, two at a time, or clamp on either side of the clamp, depending on what type of Parkland technique you would like to perform. Obviously, you're going to watch to make sure that they know how to lay down a flat knot. And again, this is a great opportunity for teaching the assistant how to keep the fallopian tube elevated on the sterile field. I do encourage people to do this simulation with gloves on so that they get a better feel for what the suture material and such would be like. You can also use the same simulation for Pomeroy. We usually will have them do Pomeroy on one fallopian tube and a Parkland type technique on the other fallopian tube so that they can try to master both techniques using the simulation. Next, when you go to cut the fallopian tube, this is a great opportunity for you to be able to teach how much of an area to leave a fallopian tube so that you can teach them on a simulation rather than a real patient how much to leave. Obviously, you're discussing watching for hemostasis as you would in a real case. There, you let your fallopian tube fall back into the cavity, and the simulation is essentially complete. We have had success using the simulation at our institution. We encourage you to try it at your respective residencies, and of course you can do additional enhancements with the addition of fascial entry material and possibly using other materials to mimic the fallopian tube.